Hi, I'm Alex Davies-Jones. I'm the Labour MP for Pontypridd, and I have introduced a 10-minute rule bill to try and tackle the issue of IVF add-ons and also to create more transparency within the IVF process here in the UK. Now, since I was elected, I've been very open and honest about my own struggles with fertility. I've talked a lot about my journey through IVF and how I'm extremely lucky that my one round that was self-funded, because I was subject to the stepmom penalty, did result in my lovely little boy who's now 5 years old. But my route to having IVF treatment wasn't easy. It never is. Anyone who's been through this process, or if you've had a loved one who's been through this process, knows how emotional, physical and financially grueling the whole situation is. That's why when I was elected to Parliament in 2019, I made it my mission to right the wrongs that I and so many others have faced when trying to access fertility treatment. Now, my 10-minute rule bill is focused on IVF add-ons. Now, we've all heard about these add-ons, whether that's embryo glue, scratching, extra testing that you can have done on your embryos, and all of this stuff sadly isn't backed up by the science, and it is being upsold by some unethical fertility clinics to people when they're in their most vulnerable state. Now, I wanted to do something about this, and I approached the government trying to right this wrong, trying to create some more transparency about when clinics are offering these treatments to patients, about how they should be honest about what is the percentage likelihood of them working, not just trying to upsell these treatments to people when they are in their most vulnerable state, when you're so desperate to have a baby that you will do anything and spend any amount of money just to give yourself a little bit more of a chance of it working. So I introduced this 10-minute rule bill into government, pushed government on trying to do something about it, and I'm pleased to say they have acted, and they are, with the HEFA, holding clinics accountable for what they're trying to sell to patients, because you want to be treated like a patient and not a customer. The other aspect of my 10-minute rule bill was focused on the data transparency about how many rounds of IVF are being funded by the NHS and how many are being funded privately. Because we all know that to access fertility treatment in the UK is sadly a postcode lottery. We need to end that. We need access to fertility treatment to be available for everyone who requires it. Currently, only half of all fertility treatment for under 35s are actually funded by the NHS. This is scandalous. It's not fair. It's inequitable, and we need to change it. So my 10-minute rule bill would have made data more transparent, so we know where this is happening, which health boards, which CCHs are funding this treatment, doing what the NICE guidelines say. And finally, I've been pushing for an update of the Act because we know it is out of date. It was great to see the government recently commit to allowing HIV positive patients to be able to donate sperm and gametes so that they can access fertility treatment. This was updating an Act that is way out of date, but sadly so much more needs to be done. The final thing I'm really keen on pushing is workplace acceptability. So getting that recognition in the workplace by your employer that you need fertility treatment, that you can have time off. So I'm working with my party, the Labour Party, to look to see what we can implement in an employment bill if we're elected and we form a government, because we know that needs to change. And finally, I want to talk about education. Because in school, all we are taught about is how not to get pregnant. That is the basic sex education that we get in school. We need to have a more robust curriculum that focuses on healthy relationships, that focuses on sex education, so we can talk to women about what might happen if you can't get pregnant, and boys too. We need to be involving everybody in the conversation. So I hope that gives you a flavour of the things that I'm doing here in Parliament to try and push that agenda, to try and get the issue of fertility on the tables here of the policymakers and the legislators, the people where it really counts. But if you've got any ideas on what we should be focused on, please get in touch with me. That's what parliamentarians are all for. We love being lobbied by constituents, by organisations and by charities to talk about the issues that matter most to the people here in the UK. Thank you.